Thank you everyone for joining. This is our third learning series webinar. This one's related to how to connect Canadians to COVID vaccines. So we're looking at a kind of a pressing topic. I think it's interesting right now because this has obviously been a topic for a long time, but I thought why this was relevant now is because things have changed a little bit. And when I say that, what I mean is that in Canada, at least, most people who are willing to actively go out and go and get a vaccine, most of those people have gotten them now. And so we're left with a remaining group of people that need a bit more outreach, need a bit more help in getting those vaccines. And that's for a variety of different reasons. I'm not necessarily going to get into the specifics right now, but a variety of different reasons. And so a more active approach, a more outreach oriented approach is kind of needed. And there's a lot of transit systems that are helping with that and in different various ways. So I think that's really interesting. And so we have a few speakers that are going to kind of talk to how they're doing that or how that can be done. So we have two speakers from TransLink. We have Aliya Mohamed, who's the head of public affairs, and we have Kyle Rosenke, who's the senior affairs advisor. So they'll be going first and they'll give you a bit of a presentation, a bit of an overview as to what TransLink is doing in this area. And then we also have Stewart Mader, who's a communications advisor who works on a number of different files, but the most relevant one to our discussion is VaxTransit. He's doing a campaign throughout North America to help transit systems with these efforts of getting vaccinations to people, helping communicate what they're doing in an effort to help people understand what transit's role is in this area. So given that, I'm going to invite Kyle and Aliya. Hi.
Hi, Simon, thanks.
And when you guys are ready, you can share your screen and take away your presentation.
Okay, Kyle, over to you. Great, so thanks so much. Kyle, we'll just move to the first slide here really quickly. As mentioned, my name is Aliya Mohamed and I run the public affairs team here at TransLink. And so what that means is government relations across the board. So we work with 23 municipalities, the mayors, which we'll talk about in short order, and then the federal and provincial government relationships as well. We deal with all the consultation and engagement, outreach and partnerships. We do a lot of that where we're seen in the community. This is part of that effort. And then Indigenous relations, as well as working alongside all of our sister transit agencies around the country and across the world, really. So this is a map of TransLink and our service area. It's about 1,800 square kilometers writ large. We have about 53 SkyTrain stations, 1,600 buses, 5,000 bus operators, and 8,000 staff with 2 operating companies, both for the SkyTrain side and then for the bus company side. And I know Kyle's going to talk about our efforts with Coast Mountain Bus Company in short order during his portion of the presentation. As mentioned, we work with 23 municipalities, so the mayors, the councillors across the board, and we're a monopoly system across Metro Vancouver. We deal in the sea ferry space, the automated rail, bus, commuter rail, you name it, it's kind of in our wheelhouse, which is very exciting for us, and we have a great time doing it. So let me talk just a little bit about, pre-COVID, we were really bursting at the seams. Our ridership was, above the roof, 100% and more. And, when COVID hit, we hit about 18% in terms of our ridership numbers. So that was a really, really low end for us. And there were challenges both from an operational perspective, from a staffing perspective. And some of the talk we were doing prior to joining the webinar itself in the waiting room was around operational funding. And so working in close collaboration, both Kyle and I with CUTA, partnered with the province of Alberta, the province of Quebec, the province of BC. Luckily, we were able to work closely with the provincial government, and the federal government came out and they both supported us to the tune of $2.7 billion across the country for Canada and the transit agencies, which amounted to $644 million for TransLink. And so we have been able to maintain our service levels because of that, and still, service the frontline employees and staff and also, grocery store workers, nurses that all needed the service to get around during the pandemic and its height. So where are we now? Well, we're in the mid 40s in terms of ridership levels. We've recently launched a reconnect campaign around the region, and that's really reminding people the service is there. People are leaving their homes again, so please use it as they're getting out. And the city really is slowly opening up. There's more festivals coming up this summer, events. Sporting events are back on track and happening in earnest post-secondary early in the fall. And, we've got a lofty goal to really increase our ridership numbers. And that's where, even vaccine distribution and supporting that comes in. And that's where Kyle, my colleague and someone I work very closely with, really comes into play. His role within the team is the provincial government relationships, the federal government relationships, and he was instrumental in the operational funding advocacy piece. And we wouldn't be where we are in terms of vaccine distribution support without him really just picking up the phone. We were not mandated to do this. He picked up the phone and talked to the health authorities and proposed this idea. I think we started with, hey, what about giving out vaccines on the SkyTrain system itself? Sure, buses, So we've come a long way, and we've done about 8 vaccine buses, and he's going to talk about the journey that we took to get there. I think Kyle will correct me, but about 70 people per day as we get the vaccine bus out there, and we work closely with our health authorities. The main one being Fraser Health, and some of those were actually first-time doses. So without further suspense, I'm really going to turn it over to my colleague and friend, who is our subject matter expert on how we got this stood up here in Metro Vancouver and what we did in the past, even as COVID was hitting, around health, safety, and just keeping our system safe writ large. So Kyle, over to you.
Okay, thank you, Aliya, for the gracious introduction, and we'll take you all through a little bit of a journey of our interaction with the health authorities and how we've got to the space that we're at now. Thank you for CUTA for having this webinar. I think it's a really good opportunity to talk about some of the initiatives that we've been doing, what Stewart's hearing in the US, and how we can all continue to work together to get people vaccinated. So in BC, we're split up into different health regions. So in Metro Vancouver, where TransLink operates our services, we deal with 2 health authorities, Vancouver Coastal and Fraser Health. Fraser Health is the largest health authority in British Columbia, and Vancouver Coastal is the 2nd largest. So there's kind of 3 stages of support that TransLink and our operating companies have been working with the 2 health authorities on: the pre-vaccine period, early vaccine rollout, and where we're at now, kind of in the later stages of getting the last few people vaccinated. In the pre-vaccine time period, similar to many agencies across the country, we were extremely focused on how we could ensure that both our customers and our frontline operators were safe, that our system was clean, and that we were continuing to try new and innovative ways to increase both of those aspects. So we launched our Safe Operating Action Plan early on in the pandemic. This was, increased cleaning efforts, putting barriers behind each one of our operators in the bus fleet, ensuring that our staff had the appropriate PPE, and then putting a mask mandate within our system. And I think, interestingly, we also launched a copper pilot where we put copper coating onto high-touch surfaces. And it was really successful in killing bacteria, which at that point of the pandemic, it still wasn't a known thing that it was respiratory and based illness. So it was a really interesting way for us to continue to do that, and something that we may look at in the future for another action to keep our system and our fleet safe and innovative. The second way that we tried to help the health authorities, working with both of them, was figuring out ways that we could utilize underutilized space throughout our system, particularly park and rides. We knew that traffic was down across our system, both in terms of people using vehicles on the roadways and our ridership. So in the fall and winter of 2020, we worked with Fraser Health to launch 2 testing sites at our park and rides. Both of these sites were able to do around 1,300 people per day for testing. So they were really efficient, really easy. You would drive your vehicle in, a Fraser Health nurse would come up to you, you do your test, you get the results quickly and you're able to move on. So it's a really efficient, easy way for people to be tested, kind of in the height of BC's second wave that hit in fall 2020. And then I think one of the big things that we did to support the health authorities and British Columbians in Metro Vancouver was continuing service levels. Thanks to our policymakers at the Mayor's Council and the province and the federal government, we were able to continue our service levels at pre-pandemic service levels. So even when you see our weekly journeys dipping down here in April, we hit the lowest point, there was still 75,000 people every single day who relied on our services. And without the efforts of our frontline staff and everybody behind the scenes that made sure those routes are running efficiently, those people wouldn't have been able to get to work, get to their medical appointments, and do the things that mattered to them at that time. And it was such a key component to making sure that our economy stayed open, people stayed healthy, and they're able to get to the jobs that mattered to them. So it was a really, really key component of our efforts in the early stages before we got to the vaccine rollout, which the vaccine rollout started to begin really in earnest, at least in the large population sizes in BC in March of 2020. In advance of that, we worked really closely with the two health authorities, Fraser Health and Vancouver Coastal, to ensure that we were mapping out where all the clinics would be across the region. And this is the map that we launched on our website that highlights our rapid transit networks. Those are the lines you see on the map, but also each and every individual clinic in the region. You could click on it and it would give you point-by-point directions from wherever you are using transit to get to your clinic to be vaccinated. It's a really simple, easy way for customers to be able to access them. Transit's being a really affordable, safe option to take and continuing to highlight that journey. And then as we get into offering more operating support, the real all-stars of this have been our operating companies. So Coast Mountain Bus, Handy Dart Services, which provide our paratransit work, and then also our SkyTrain operating company, BCRTC. Every time that we have come to them for requests to support health authorities, it's been an easy yes, and then asking how we can do it. So it's been really, really great to work with them. They've been super, super awesome at just saying, yes, let's get it done. And it's been really efficient, and both health authorities have been extremely grateful for how easy it's been to work with us. And I think that's really a testament to our operating company's willingness. So in this early stage, the health authorities in BC were really pushing to get seniors and those vulnerable populations vaccinated. They were doing quite successfully of going to seniors' homes on their own, but there was a missing piece, and that was how can we get populations that may have transportation challenges, that may have financial challenges that would impede them from getting their vaccine? How can TransLink fill that gap? And we did that by utilizing our Handy Dart services through Coast Mountain Bus Company. This was a really, really high impact service. It wasn't necessarily utilized a lot, but for the 100 people that we moved by this, these people had no other option of seeking out the vaccine. And I think this is one of the most rewarding components of the work that we've done. Each person would write a nice letter to the Handy Dart providers. It's a really nice high touch service that goes door to door. And it was really well received both from the health authorities and from the users that participated in this program. And then beyond that, our Handy Dart services in their normal operating with their normal customers have delivered over 3,200 trips to vaccinations to date. And it just really emphasizes that really important piece of the paratransit side that's been continually focused on providing that really good customer experience, safe, easy, convenient, taking people to the vaccines. And then the second component of the early stage was transitioning those testing sites that I spoke about earlier into vaccination sites. So we changed the 2 sites at our park and rides in March to coincide with the move to mass vaccinations. So between March and now August, over 80,000 people have gone through those 2 sites to be vaccinated. They're really convenient, attached to our SkyTrain network or just off the highway, really easy to park. And this is actually the mayor of our second largest city in Metro Vancouver, Doug McCallum, who was going through one of these testing sites. You could drive your vehicle in, you can walk in, whatever was most convenient for you at that time. And again, it's providing these really easy, simple, convenient locations for people. And we have some locations that could do that were underutilized. And it was a really easy decision for us to partner with health authorities to deliver these vaccination sites. And now we're moving into a more door-to-door campaign. We saw the trends in the US starting in May, where they're shutting down a lot of the mass vaccination sites to do more localized efforts. BC has relatively high vax rates. As of yesterday, it's 73% for first dose, 60+% for the second dose. And we know this is no longer going to be a mass vaccine campaign. We're going to be going basically door to door, trying to fill in those last gaps. And that's where we continue to try to have this ongoing conversation with both health authorities. How can we utilize our bus fleet to do this? So this is our first clinic that we did. We wrapped a bus in our Reconnect campaign, talking about how we can use transit to get back to the things that we did pre-pandemic, seeing friends, going out to places, enjoying the sports that we love. So it's bright, beautiful. We have a yellow one and we have a bright pink one. And this was in White Rock, right on the beach. So we can take these to really cool locations. Some of the most successful ones that we've had to date have been in grocery store parking lots. They've been at the beach. We've taken them to the ferry terminal, which is a really busy customer point. We will go anywhere with these so long as the health authorities find a need for them, and we continue to try to find new ways, exciting ways to do them. We've done 6 to date. We get about 70-ish people each time that we do them. So it's a really great way to kind of get those last remaining people that just haven't got it for whatever reason. Maybe it's inconvenient for them, it's during work hours. We can try to bring these to where people are, which I think is a really exciting way to get that last 10-15% of people. And this is just a quick video that takes us through one of our locations that we did at the ferry terminal.
Okay, so this is the outside of the bus. You will register there for your vaccine, and then you hop on inside, and it's air conditioned. And once you're here, this is where they will actually give you the vaccine, so administer vaccine right here. Once that's done, it takes a quick second, you wait in one of these spots for your 15 minutes to make sure there are no side effects, and then you just hop off the bus and hop onto the ferry.
So really simple setup. It's been easy for us to work with. And I think from the operator to the people who are doing the scheduling to make sure these buses are able to go out, it's been a really great experience to work with Fraser Health and Vancouver Coastal on some of these initiatives. And I think that's been the key positive for us. And it's also gotten really great coverage. Each time we do a new Vax bus, whatever community it goes into, that local paper is working to help get the word out. Everybody that comes to these is really, really happy. It's a really cool experience. It's a little bit different. We average about 15% of the vaccines that we give on the Vax bus are first doses. So we're still seeing this as a really great way to get those people through the door. So it's been a really, really positive experience, something that we're all proud of at the TransLink family and the operating companies. And it's something that we're continuing to try to find new and innovative ways to bring the bus. So hopefully that is helpful for you all, and it's certainly something that we're excited to be working on.
Hey, thank you so much, Aliya and Kyle. That was fantastic, and it's so inspiring and exciting to see it. Like, I think, the stat, I guess it's not a real stat, but the kind of stat that I always see thrown around is like the next 5 or 10% of people vaccinated could take 3 times the amount of effort that the first 70% took. So it's these efforts, these kinds of things that are probably needed to help with that and do those kinds of things. So yeah, it's great. Thank you so much. I'll invite Stewart up now. And Stewart, if you can come online. There we go.
All right, here we go. I think hopefully my screen sharing is working correctly now. There we go.
It looks like it is. Thank you so much.
There we go.
Take it away.
All right. Thanks so much. And I want to echo what you said. That was a great presentation, Aliya and Kyle, on what TransLink's doing. And I think it really illustrates the importance of transit agencies being involved in the vaccination push and the value of transit in doing that. So I'm Stewart Mader, and I work with transit agencies throughout North America. And for the last much of 2021, I started this in November or December of 2020, I've been working with agencies throughout North America to make sure that agencies are at the table in enabling vaccine access. And I've been leading a campaign called VaxTransit. And the basic idea is to beat the virus and build ridership. That's the message that I often deliver when I'm talking to transit agency leadership, board CEOs who are asking, and this is a conversation that started very much early this year as the vaccine began to roll out in the US, and it's continued throughout the year as it's ramped up, become more available in Canada and elsewhere. And one of the big questions is, how can transit agencies help? How can agencies be involved? And as you heard from Aliya and Kyle, there are lots of ways to be involved. Very early on in this, the biggest thing we saw was agencies providing free rides for vaccines. And that made sense because when you couple that with a public health strategy that for many months was largely built around mass vaccination sites, getting transit agencies to provide transit access to those sites was critical. Some of the early images we saw in the news about mass vaccination sites were showing these seas of cars, autos lined up. And some of that was understandable. It came from in the early days of the pandemic, the sort of quick action to stand up testing sites and the relatively paltry knowledge we had about how the virus spread. People felt safe in their cars. And there was this notion that having people drive through the vaccine sites was a safe thing to do while people were in quarantine. Obviously, as we've learned more about how the virus spreads and we understand the value of masking, and we have lots and lots of data from cities around the world that shows that public transit is not a vector for spreading the vaccine, that's created an opportunity for transit to be much more involved in vaccine access and in different ways. So on top of providing free rides for vaccines, and the image you see on screen is via Metropolitan Transit in San Antonio, Texas. They were one of the earliest agencies in the US to provide vaccine access. And since then, there have been many more that have joined in. Now, as vaccine, sorry, what's going on here? So as vaccine access has continued to grow, what we've seen really is, and if you think about this I come from a digital media marketing background, so I often think about things in that way. Much of what we're doing right now in getting people vaccinated, you can kind of analogize to marketing. You start with the wide funnel, you're reaching lots of people, that's the mass vaccination sites and the free rides. And then as you narrow things in, you get to things like vaccine clinics at transit hubs, which is a great way to target people who take transit and to really make sure that vaccination is as convenient as possible, especially for essential workers, transit core customers who never stopped using transit throughout the pandemic. And then also people who gradually, the portion of the population that's returned to using transit in recent months, it's a way to make vaccination as convenient as possible for those people. And then narrow the funnel a little bit further. And I think about this in terms of retargeting people, reaching people, getting mobile vaccine buses and trains out into communities. What TransLink's doing at the ferries, the buses, the examples that you gave. And then just to give a couple of others, out in Ontario, Metrolinx just this past weekend launched what they're calling GoVax. They've taken 2 of their coach buses and turned them into mobile vaccination clinics. And they were out at over the weekend at Ontario's Wonderland theme park providing vaccinations. And then here in the US, example of a train providing access in the Boston area, the MBTA, the Massachusetts Bay Transportation Authority, they started something called the Vax Express. They outfitted a train with vaccination, essentially took a train car and outfitted it as a vaccination facility. Looked much like the video that Aliya and Kyle showed, with space to vaccinate people and then space for waiting the 15 minutes to make sure you have no adverse effects and continue on your way. And they targeted that to 7 communities in Massachusetts that had the lowest vaccination rates. And what they found, it wasn't vaccine hesitancy so much as vaccine convenience. It was making sure that the vaccine was available to people in a way that fit into their day, and getting out directly into those communities plays a huge role in that. And so we're now there are more than 580 providers in the US and Canada that are doing those 3 things: providing free rides to vaccines, supporting vaccine clinics at transit hubs, and enabling vaccination with vaccine mobiles, buses and trains. And over the last few months, I've spent a time talking with agencies around the country that are heavily engaged in providing vaccine access. And I want to highlight a couple of examples. I talked to 15 agencies around the US about their work. And I want to just give you a few examples of what these agencies have done. And we'll start in Kansas City. Ride KC is the agency in the Kansas City area. They span the states of Kansas and Missouri. And they did something really innovative to reach communities and really ensure equity in vaccine access. They partnered with the major health provider, Truman Health Centers in Kansas City, and they partnered with the Housing Authority of Kansas City. And in addition to providing free rides to vaccines, they had some large mass vaccination sites at the stadium where the Kansas City Chiefs American football team plays. In addition to doing that, they also partnered with the Housing Authority and Truman Health Centers to reach out to residents who live in Housing Authority properties, communities, to make sure that they're vaccinated. And so the way it worked is the Housing Authority canvassed residents to see who needed a vaccine, put together those lists of residents who requested a vaccine, worked with Ride KC to several days a week to have buses go to those properties, pick people up, take them to Truman Health Center's hospital campus, get vaccinated, and then have a bus ride back home. And it's a great example of something that with coordination and collaboration, they targeted a population that might otherwise have taken longer to get vaccinated. It's also a great example of, as much as there's often conversation about vaccine hesitancy in some of the news coverage of this, a lot of it is vaccine convenience and vaccine confidence. And it's reaching people who might otherwise have trouble getting to the vaccine, but want to get vaccinated, and making sure that they're not left behind, making sure that there's a way for them to get there. And Ride KC's partnership shows an innovative way to do that. In Dayton, Ohio, the Greater Dayton RTA, you see here, they outfitted a bus. Those look like some of the most comfortable seats I've ever seen on a bus. I really want to sit in those. They outfitted this bus as a mobile vaccination clinic, and it has gone around the Dayton area providing vaccines. And one thing they did to couple vaccination with their rollout of their new tap and pay fair payment system, they offered people $30 in ride credits for getting vaccinated. And it's a great coupling of the public health benefits of getting vaccinated, the ability of the transit agency to get out into the community with their mobile vaccination buses and cover lots of areas, reach communities, and give people a really nice incentive. And part of the reason they gave $30 in ride credits is on their new fair payment system, which has fare capping, $30 is enough for somebody to ride for a full month. And so they really were giving people a month of access to the system. And that's a great way to build, for people who are transit riders, it's a great reward. It's a great way to give them a little financial incentive. And for people who might be trying out transit for the first time and kind of experiencing transit for the first time because of vaccination and VaxTransit, it's a way to build transit use as a daily habit. In fact, they had quite a number of people, more than half of the people that used their VaxTransit service early on, and we're talking sort of the March, April timeframe, were people who were brand new to transit. And I think that shows the further power of this, not just to get people vaccinated and protect communities, but to build transit ridership. And here we're talking about building new transit ridership. This isn't just bringing people back who might have been working from home. It's people who never rode transit before. So that's another great example. And then lastly, in the Toledo, Ohio area, the Toledo Area Regional Transit Authority, or TARTA, they partnered up with the Lucas County Health Department and a project called the V Project, which is a vaccination project led by a coalition of community leaders, businesses, civic organizations. And they outfitted a bus to serve vaccination sites throughout the community. And it's a familiar story in that TARTA started by providing free rides to some mass vaccination sites. And then as those sites wrapped up in late spring, they transitioned to providing the vaccine bus. And what you see on screen there is an example of the schedule. That's just 1 week's schedule of vaccine clinics with the bus. And so they were everywhere. They were really reaching out to communities and getting as far and wide as possible with the vaccine buses. And what that shows is the reach that mobile vaccination can have in getting out into communities. And so there's really, I want to leave everybody with a few things to think about for VaxTransit. The most important thing you can do on top of operationally preparing to provide vaccine access, working with community partners, particularly health systems, is to build awareness in your community. And that means making sure you've got information about what you offer on your website, that you're also out as much as possible reaching people in regional trip planning tools, 511, 311, whatever tool is out in your community that's advertised for people to use to get transit information. Sharing on social media is really critical as well. posting information on buses and trains and at stations. This is a really important one too, especially for portions of your customer base who might not be primarily interacting with you through technology, but are riding the system. They're on the system. If they're not vaccinated, it's a perfect opportunity to reach them and make sure they know that it's convenient and available. And then to work with public health officials to make sure they're spreading the information through their channels. And then lastly, with local media as well. And local media coverage is a really critical one here because when you think about the benefits of doing this, there's the immediate public health benefit of getting people vaccinated. And then there's the mid and long-term benefit of changing perception of transit. One of the negative things that took hold early in the pandemic was this idea, this fear that transit might be a vector for the virus, for people getting sick. We know that's not true, but we also have the challenge of making sure that as many people as possible know that that's not true. Providing access to the vaccine is an ideal way to do that because you're getting somebody vaccinated, and every person who's vaccinated is at less risk of getting COVID. It also, and by dint of doing that, it sends the broader message that transit is part of the solution. It's part of the way out of the COVID health crisis. And that's really important when we talk about things like structural funding, which I know is a big topic in Canada right now. It is and has been a big topic in the US as well. In 2020 and early 2021, we've seen in the US the largest amount of new funding from the federal government in transit operations that we've seen really in a generation. And that's really critical for transit agencies for keeping service going, but it's also really critical for transit agencies to show how they're using that funding really well to make the case to continue that funding. The best way to convince policymakers, lawmakers, legislators to invest in transit is to show that the money that they've invested during the crisis is being put to absolutely good uses that really have a transformative effect on communities. And that's vaccine access by transit. And I'll leave it there. I'll just add one last thing on the slide here. You see there's a couple of images, these stickers, as I call them, virtual stickers. They're available on my website, stewartmader.com/VaxTransit. And any agency that's listening, you're welcome to use these in your marketing materials. They're there and available to download in multiple formats, including vector format for printing and versions that you can use on the web. And lastly, if you want to read the report with the profiles of the 15 transit agencies, that's available at stewartmader.com/CTAA. Thanks.
Thank you so much, Stewart. I think, you know, what comes to mind when you're talking about some of the stuff at the end is just like the reiteration of the theme of transit that came out during COVID was that transit supports the most essential and vulnerable parts of the community. And this is, it almost reaffirms that to some degree as well, right? Is that transit continues to support those people. And I think when you're talking about advocating for operating funding and different things like that, that message is really important because you can't really do without it if it supports such a critical audience, right? A critical part of your city. So
that's right.
Okay, so I'll invite Kyle and Aliya back, and we'll do some questions. We'll go through some Q&A. Okay, given that, I'll get started with a few questions. I'll go first to well, either of the folks at TransLink, I guess, whoever would like to answer. I'm curious to know a little bit more about the discussion that you guys have or the relationship you have with your public health agency and how you kind of like use that relationship and then figure out like how to run things, where you're going to run them, like kind of, you know, take that discussion with them and move it into more of an operational plan.
Kyle, take it away, because it was literally you picking up the phone. We had relationships, of course, with both of our health authorities in the part of the region that we operate, or rather our regional space. But, you know, it was really Kyle picking up the phone to say, hey, what's the appetite? And, you know, we kind of told that story a bit during the deck, but, you know, if you want to elaborate on that, Kyle, maybe their reaction, their response, how we sort of moved it. There were legal challenges, of course, because we all grapple with that. And anyways, I'll turn it to you.
Yeah, I think the key is just persistence. The health authorities were so inundated with so much stuff during the pandemic to get all their vaccine sites up and running, to get all the staff ready to go. They were just so busy and running flat out for so long that I think one of the key things that we could offer them was something relatively simple, and we would help with a lot of the logistical work. So I think it's just continuing to offer that to them. Like, I think our beginning discussions about a mobile vaccine bus would have happened in April. And it wasn't the right time for them because they're focusing on the mass vax sites, but continue to bring it up, continue to offer it to them. And I think the relationship with health authorities has become really, really strong. We're a really great, well-oiled machine now, but it was just continued conversation with them, continued offers to be open to new ideas, to try new things. And some things have worked, others haven't, and we continue to try to learn with them. So I think it's just been continuing that dialogue and not being afraid for things to go silent for a few weeks, then coming back again when they're ready. So it's been good.
Great.
A lot of what we're able to get done is persistence.
Yeah. Yeah, and it makes sense. You know, I think it's a good aspect to things that I maybe didn't think of is how busy, you know, the public health agencies are right now, and maybe overburdened, and so it can take a more active role to kind of get the ball rolling and get stuff happening. But it's really important. Stewart, I'm just maybe I can ask you a little bit about how you kind of this is a bit of a shift, but how you know, you talked a lot about this messaging and using it kind of to advocate for additional operating funding and that kind of thing. How do you then use that message? Like, what's the way to take it away and use it as part of your advocacy?
That's a great question. What it boils down to is there's the pandemic's been obviously in many ways devastatingly disruptive to daily life. But what it's also done is it's given us an opportunity to draw attention to things that were, I think, to some degree overlooked before, maybe even taken for granted. And when it comes to transit, you know, for people who don't use transit on a regular basis, it may not be something they think about all the time. And it may be something that they only think about when they hear that there's, you know, there's a delays or there's a, you know, service issue or something like that. You know, as it is with kind of news coverage, it tends to be that the coverage is when there's an incident, not when there's good news. And oddly enough, the pandemic has given transit a lot of good news in that being able to reconnect communities, to support essential workers, and to provide vaccine access, those reinforce and remind the public how critical transit is to communities. You know, because we're talking largely about vaccine transit here, I focused on those examples. But when I talked to those 15 agencies around the US, one of the other things I heard from transit agencies was the work that they did before providing vaccine access, VaxTransit. In fact, the work that was foundational to that was doing things like minimizing food insecurity, doing food distribution to communities when people were in lockdown, particularly to elderly, disabled, at-risk members of the community. One of the best stories from that comes from Minnesota, the southern Minnesota area transit agency, or SMART. They're based in Austin, Minnesota, and one of the other organizations that's based in Austin, Minnesota is Hormel Foods, and one of their best known products is Spam. And there's actually something called the Spam Museum in Austin, Minnesota. Well, when the pandemic hit, the Spam Museum was closed. There weren't really a lot of tourists going to learn about the history of Spam, which on its own is fascinating. But what they did is Hormel, they invested in their community. They paid businesses, largely these small businesses, delis, pizza shops, restaurants, to make meals. And then those businesses delivered the meals to the Spam Museum. They used that as their coordination point. And then SMART brought their buses to the Spam Museum. Volunteers loaded the buses with all those meals, and they went out throughout the community and delivered those meals to vulnerable members of the community. And I love that story because there's a business in there that could have, you know, kind of just said, well, we're going to focus on ourselves, but they didn't. They actually put money in the community and kept a lot of small businesses running. There's a lot of people whose jobs were saved, were preserved by being able to do that work. There's a lot of people whose food needs were met by having those meals. And the linchpin in all of that was the transit agency, because the transit agency had the vehicles to get out in the community, the drivers who know the community, staff who volunteered to help get those meals out and go deliver them to the community. And when I talked to Kirk Kuchera, who is the executive director of that agency, one of the things he relayed to me was how important that work was in preparing them to then provide vaccine access, to do VaxTransit for their community, because they were already talking with public health officials, city officials. They already had those relationships warm and working because of the work they were doing around food insecurity, and it naturally led into into the VaxTransit work. And where that all really matters, where it all comes together on the advocacy side, is when you can tell a story like that to the folks at the state level and the federal level who are making the legislative decisions about where to invest resources. Those are the kinds of stories that remind them that it's worthwhile to put money into transit. And that transit agencies are, we talk about police, firefighters, EMS, we talk about those types of people as, essential. We think of them as kind of the quintessential frontline workers. Well, transit workers deserve to be right there alongside them. And we need these kinds of examples to reinforce that message and to build that in the public consciousness. And I think that's happened more than ever in the last year, despite or kind of amidst all the disruption of the pandemic.
Yeah, that makes a lot of sense. It's really important right now to have that message out there, right?
Mm-hmm.
To our folks at TransLink, I'm wondering if there was, given the importance of this, how did you also balance that against your regular kind of operational needs? Especially right now, I think that's got to be really challenging as you're running, basically full service, things are reopening and kind of balancing those demands. Were there any challenges there?
Yeah, I think the key component of this goes back to how great our operating teams are, both at Coastbound Bus Company and at HandyDart, working through these challenges. We are running full service, but we're using our spare board quite a bit to be able to fill in gaps where we see overcrowding. So we're able to utilize that spare board to run these trips, but it really comes down to the ingenuity of our operating teams. They figured out ways to make this work where it could have been easy, I think, to find ways that this would be too challenging to do or too straining on resources, but they always found some way to make sure that we could deliver these services for our partners and the health authorities. So I think it really comes down to that. It was just, we're going to say yes to this, we're going to find a way, and they've found a way to continue to deliver over and over again for us.
That's great. And it shows that when something's important enough, you kind of make it work, right? You do what you can to make it work. Stewart, I'm curious to know, I really like the example you gave of kind of a system that, I can't remember the system name, but that kind of tied their vaccination efforts to an existing promotional campaign they already kind of had going. And I wonder if you have any other thoughts on that, or any other areas you think that would be good. There's a lot of those kind of things going on right now as we're looking to bring people back to transit. There might be temporary fare options or different promotions to help people. Do you see more of an opening there to kind of pair those things, like in your example?
I do, yeah. So that example was Greater Dayton RTA, right, in Ohio, and I do see more of that. And I think in Dayton's case, what they did was pair getting people vaccinated with the financial incentive, and there's kind of a benefit for everybody there. There's the public health benefits everybody. Everybody who gets vaccinated is protected. Everybody around them is protected. The transit agency is protected because they use that as a push to get their employees vaccinated. And obviously, the more people who are vaccinated, the more comfortable people are getting back to using transit. So there's all that angle. And then on the fare payment and customer experience side, there's a benefit for customers in getting an incentive. I mean, getting $30 or essentially a month in free transit rides is a really nice incentive. It's an opportunity to use transit more, and their new fare payment system, they replaced essentially an old paper ticketing system and cash on the buses and all of that with this tap card system, which one of the big benefits of that, we know for transit in general, is fare capping. It's making transit more affordable, especially for people who are lower income, fixed income. And so they couple the public health benefit of vaccination with growing adoption of that fare payment system. That's also beneficial from the standpoint that those types of fare payment systems lower costs for transit agencies. So getting that in place, that ultimately works out better for them in terms of cost savings, and having a transit, and also having a fare payment system that gives them better analytics on where their riders are going and being able to understand how to optimize service. So what I like about that is it's an opportunity to couple this immediate push to get people vaccinated with things that tie into the kind of everything from the short to medium to long term in terms of how transit evolves coming out of the pandemic. One other really good example like that is out in California, Monterey Salinas Transit. They're testing out a new what's called an open loop fare payment system. And that's open loop where basically instead of having a transit card, you just tap a debit card or credit card at their machines. And they're the first agency in California. They're working with the California Department of Transportation on this new, what's called Cal ITP, or California Integrated Transit Payment. And it's the DOT plan is basically to come up with an open standard for transit payment that every agency in the state could use that would allow open loop payments. And that really, when you think about lowering the cost of both fares for riders with things like fare capping, and also lowering the cost for the agency and efficiency, it's a real benefit. And so they've similarly coupled their vaccination push with the rollout of their new fare payment system. And I think those are critical because one of the things that we've all had to sort of live through in the pandemic is adjusting service far more frequently than is usual. You know, most transit agencies, you work with your represented unionized workforce. Typically, changes are made maybe twice a year, maybe 3 times a year. It's often coordinated with picks for unionized staff for the work. The pandemic threw all of that out the window. Service changes often had to be made on a weekly basis at times. In some cases to align with and coordinate with decisions that were being made at the state, provincial, federal level on lockdowns and quarantines and so forth. And then to shift to providing, adequate space on board vehicles for social distancing. So we live in a world now where we have to make decisions faster. And I don't think we're going to go back to having this sort of few times a year service changes. I think we live in a world now where we know we need to be much more adaptable. And so the more that we can couple vaccination with rolling out systems that allow us to make those decisions with better intelligence, better data, it's innovative, but it's also the new normal. It's also what it's what it's going to look like for us going forward.
Yeah, absolutely. A lot of stuff has changed, and maybe not everything is temporary, right? There's definitely going to be some stuff that are going to last. Aliya and Kyle, I'm curious to know how you coordinated or how you are coordinating exactly where the buses will go and where those vaccination clinics are set up. You talked a little bit about it, but I'd like to know maybe if you can share more about some of the specifics around that and how you target certain areas or certain locations or maybe even certain events.
Yeah, it's all through the health authorities. So they have that localized data that tells them where they are seeing lower vax pickups or where there may be a certain target population that is more in need. And we've also worked with other community groups in some major city centers around where they've been requesting us to come and help them vaccinate. So really, it's a combination of efforts with the health authorities, with local groups of where we see needs or the health authority knows there is needs, and then we try it out. And that's the beauty of the mobile vax bus, is that it's very open to experimentation. If one location doesn't work, we can try a different one the next day or the same day. So it's really been a joint effort.
Okay. So maybe I'll start. I think we can maybe wrap things up a little bit. We can do one more question for each, and I'll make this a bit of a lighter question. So I'll start with maybe TransLink. And can you guys maybe share if you guys have something in mind where maybe there was a really positive story, or you got some positive message from a customer, or some example you can share? I hope that's not putting you on the spot too much, but I just wonder, there must have been examples of really positive stories. I think you guys talking about the number of first doses given is really positive, because obviously those are people who knows when they would have gotten the vaccine or if they would have. But if you guys could share any maybe positive stories that you kind of had from this.
Yeah, I think it's exactly that. So our mobile vaccine bus, really because of Fraser Health and the health authorities' stance, is low barrier. You don't need a provincial health number, so you don't need a health card proving identity. You just need to come and show up and tell us that you haven't been vaccinated. And if you don't have a provincial health number, they'll make one for you. I think that's been the big story. Each time someone who's getting their first dose comes in, every nurse on the bus cheers, everybody's excited. And seeing those people come through for the first time that may have been hesitant, that may have had reasons why they haven't gone yet, seeing how like a wave of relief comes over them, seeing the people and the nursing team that is just so excited to do these. I think that's been the biggest benefit. We've done quite a few of these now, and it's always great to get second doses, but I think that first dose story of seeing people come through for the first time it's always fun, and it's always great to be a part of that.
That's awesome. Thank you for sharing.
I'll just add one
Yeah,
more.
go ahead.
We were at the ferry terminal, and there was a father and 2 kids and a wife, and they were getting ready to board the ferry, but they had a bit of time, and he hadn't got his second dose, but she had, and I could see her sort of convincing him. And of course I walked up there and said, hey, it's like literally 15 minutes. And what convinced him was Pfizer, but ultimately he went in the bus, he got the thing done. But it's nice to just be there and have that conversation in person and sort of say, just super quick. And so just fun to be a part of it and watch those types of people just come through and just get it done. You know what I mean?
For sure, and it shows you how making it super easy is the key, right? Stewart, before we part, maybe I can just ask you a little bit about any of the work you're maybe doing outside of this, that helping agencies recover from COVID, and maybe some other stuff that you might be doing.
Sure, great question. So big focus right now is on VaxTransit, is continuing this. And it's, as I say, it's been kind of a multi-phase. A lot of the work toward the end of last year and early this year was around the free rides and getting people to mass vaccination sites. That's since shifted to much more of a focus on hosting vaccine clinics at transit hubs, and then to mobile vaccines. And I think mobile vaccines is going to be the long tail. I think we have months of this ahead of us. And I'm glad about that. I think that's really good, because I think in many ways, the longer we continue this story and we continue this work to get people vaccinated, we know we've got a kind of the population that needs to get vaccinated is diminishing in a way, but it's going to be a little more challenging to get them. But I also think that makes it all the more rewarding to continue doing it. And then one of the big things that's now coming up in my conversations with agencies is, what do things look like after we do this? And one big question is coming up is obviously around masking. It's a bit of a contentious issue in parts of the US. There's a bit of a question around, do we need vaccine? I mean, do we need masks and so forth? And if you kind of look at the ebb and flow of things over the summer, it began to feel in the US as if people wanted to sort of toss the masks away as they were getting vaccinated, and hey, we're free of this. And then as the Delta variant has picked up, we've just in the last couple of weeks where I am around Washington, DC, we've had indoor mask mandates come back into effect. And the funny thing is, the one constant throughout all of this, in January of this year, when President Biden came into office, he signed an executive order mandating masks on transportation in the US. So airports, buses, trains, you name it. And then that order was extended in May until September. And that order has kind of made transit an oasis of relative, I think, kind of calm in a way, in terms of, people know they need to wear the mask. It's backed by federal law. The message is out there. And it's one of the few places you can go where people are just masked up. There really isn't a lot of debate about it. I think one of the questions now coming up is, we're in August, the Delta variant is picking up. Does the mask mandate in the US expire in September, or is it going to get extended again? If I had to put my money on it, I'd say we're going to need to extend it a little bit longer. And I think that's probably I think that's a good thing, because I think that we're heading into the fall and heading into flu season. And that leads into another thing that I'm talking a lot with agencies about, which is, aside from COVID, or kind of parallel to COVID, as we get to a point where COVID, hopefully in the coming months, it recedes as a pandemic and it's going to become something more endemic and we're going to have to keep, focused on vaccination and focused on good public health measures around it. But what really comes into sharp focus is flu season. And as we get into flu season, I think about the numbers for, at least in the US, for flu cases and flu-related deaths in the US, they were absolutely minuscule. They were in the dozens to hundreds, where the year before they were in the tens of thousands. And there's multiple factors for that. To some degree, it's quarantining and people not being out as much plays a factor, but masks undoubtedly played a factor. And so one of the things that I think transit agencies can benefit from is, as we get to a point where masks are no longer mandated at some point, building masks into kind of the language of transit, I think is going to be really important going forward. I think making masks, continuing to make them available. Lots of agencies have stocks of masks. continuing to have messaging around normalizing masks is going to be really critical, because what we don't want to have happen is an instance where the mandates go away and then there becomes a stigma around masks, or the risk that somebody is harassed for wearing a mask. And so I think it's going to be incumbent on transit agencies to build that into regular messaging. And, you know, as often as you say, stand clear of the closing doors, watch your step, I think it's also going to be masks are welcome if you want to wear them. I think that's going to need to become something that's part of regular messaging. And it's also going to be positive and beneficial for agencies to do that, because if we can get through flu season without people getting the flu, I'm all for that.
Yeah, thanks. I think, you know, with the Canadian systems that I've spoken to, there's very differing opinions, because here, you know, in Canada, it's very provincial, right? Each mandate, and sometimes even municipal, right? But I think there's differing opinions on if the overall regulation gets lifted for masks, does transit follow or not? And I've heard differing opinions. One saying, well, if you don't follow along, then you give the perception that transit is unsafe, because why isn't transit following? And then on the other hand, I've heard the explanation of, well, we should, you know, transit systems should seem like the safe place by keeping mask mandates and being more welcome. You know, I've noticed that even though there are differing opinions, people do seem to be very passionate on one thought or the other, but I don't have an answer to that, but I think it's a good point of view. I think your point of view, Stewart, was really well spoken and really well thought out. So I'll leave it there for everybody to think maybe on that idea and the differing viewpoints there. But I just wanted to thank you, Stewart, Aliya, and Kyle, so much for taking your time and preparing the presentations and coming out to do this presentation. I really do appreciate it. If anybody would like to contact any of our speakers, your information is on the screen, so feel free to take that down. But thank you so much for doing this. I really appreciate it. And hopefully we get to talk soon. So thank you so much.
Thanks, Simon. Thanks, Oliver and CUTA. Bye.
Thanks, everyone.